Hi, I'm Dr. Silverman, and I'm going to be going over the x-ray finding of a patient of mine. And then after I do that, I'm going to introduce you to him, and he's going to explain to you a little bit about the results that he's been able to get without surgery, without hospitalization, without even the use of medications. Just by getting the spine in proper alignment, we've been able to take the pressure off of his nerves and get incredible results in a case that almost any doctor, whether you're a neurosurgeon, an orthopedic surgeon, any type of doctor out there, if you heard these MRI results on this patient, you would say this person needs immediate surgery. But instead, this patient had a tremendous faith in God, he had a tremendous faith in me and the treatment that I do, and he commuted from Naples to Miami for treatment. So we're talking about a 2.5-hour ride, twice a day at the beginning, and once a day since then, and he's been coming for the treatment, and the progress has been slow but steady, and now he's at a point, well, I'm not going to ruin it, I'm going to let him tell you a little bit about how he feels. So first, let me just give you a little bit of his MRI results that were taken on him. Number one is that in the L2 and L3, and here we have, whoops, here we have the spine. And when we talk about L2 and L3, we have L5, L4, L3, L2, L1, T12. So between L1 and L2, there's a disc. Between L2 and L3, there's a disc, and 4 and 5. So in his particular case, between 1 and 2, there was no disc herniation, and everything seemed good. In L2 and L3, he had a right foraminal disc herniation. In other words, the disc was actually broken or torn, and where the nerve comes out was actually compressing the nerve. Okay? And it says here that he had mild to moderate right neuroforaminal narrowing, meaning that the space where the nerve comes out of has been narrowed by the disc so that the nerve cannot get out. He also had a broad-based bulging disc between L3 and L4, and also between L4 and L5. He also had a disc herniation. Again, that's in the lower part of the back, and the disc is being compressed. And also between L5 and S1, he also had a disc herniation with disc compression. And he also had left neuroforaminal. So on both sides of the spine where the nerve comes out, in both cases, this patient had disc herniations and interference with the nerve supply. Now, what does that mean to the patient? Well, let's take a look at some of the symptoms. I have his chart here right in front of me. And let me just tell you real briefly that this patient came in with excruciating pain. Not severe pain, not intense pain, but excruciating pain in the lower back. But that pain also radiated to the right side. It radiated down the right leg, and it also caused numbness, tingling, cramping. He wasn't able to sleep. He was barely able to walk. And he came to us as a last resort because somebody in his family was a patient of ours years ago. I believe he was a patient of ours years ago. And he decided that before he's going to go to the hospital and get surgery, he's going to try the results with me and the techniques that I use here at the office. So he started his treatment, just so you know, back in August. And now we're in October. So we're looking at August, September, we're looking at almost 3 months of care, or about 90 days of treatment, which takes, 90 days is about the right amount of time for most types of cases that come in for treatment. Some take longer, some take shorter, but depends on the amount of injuries and problems there are in the spine. This is something that also occurs very frequently when people do a lot of heavy lifting, a lot of heavy work, or when they've been involved in accidents where there's damage to the spine and the spinal column and the spinal discs, and they develop all these problems. Now, with the amount of numbness and pain that this gentleman was having, I mean, we were already talking about the possibility of needing surgery. So now what I'm going to do is I'm just going to turn it over to him and let him tell you exactly how he feels. Can you speak this in English, or it has to be in Spanish?
In Spanish.
Okay, so even though my Spanish isn't perfect, I'm going to translate it. Número uno. Number one. How do you feel today?
Bien. Me siento bien.
So you feel better?
Mm-hmm.
Okay. ¿Tiene dolor en sus piernas? I'm asking him if he has any pain in his legs.
Hoy no tengo dolor en la pierna, no tengo... he mejorado un 100% de como yo vine aquí y lo hice porque vi los resultados de mi padre en años anteriores que tuvo ese problema y se sanó, y por eso puse fe en el doctor y fe en Dios en que me iba a recuperar, y hoy, gracias a Dios y al doctor, me siento bien, no tengo dolor y puedo recomenzar mi vida de nuevo como lo hacía antes.
So what he's saying, for those of you who don't speak Spanish, because here in Miami everybody speaks some Spanish, but for those of you who don't speak Spanish, what he's basically saying was that his father was a patient, he had tremendous faith in the results that we get here in this office, and that he feels much better, and the pain and the numbness and everything is better, and he's like a new person. So my question to you is, the problem that you've been told that you can't get rid of, many cases, not just back problems, but other types of problems, get well with the type of treatment that we do. Because remember, the power that created you is the power that heals you. And when people get injured, especially in a fall or an accident, things shift around in the spine, and many times the pain doesn't even start right away. It may take a little while before it starts. And if you get to it right away and you correct it right away, you can prevent problems in the future. So for those of you who are in pain, this is an important lesson that you can get well without drugs and surgery. And for those of you who've been involved in accidents, this is an important lesson to let you know that you need to come in and get to the cause of the problem, or the problem will continue to get worse. I hope this person's testimonial has helped you in your own particular situation. Thank you.